A God wink is when you go through something that you think, why would God do this to me? And when you get through it, you realize he had your back the entire time. And, it's about the most difficult concept in life, which is an F word. And that F word is faith. Hi, I'm Stephen Drabeck, and you're entering A World Gone Good.
Well, hello, my name's Steve, and this is the place where we shine the light on everyday people making good happen each and every day. Welcome to World Gone Good. Quick reminder here to follow us on your socials. You can find us on both Instagram and Facebook. Give us a follow or a like, and you're going to get in early on all kinds of things like episode audio promos and trailers. You'll find out about upcoming good guests. You might even find some bonus good stuff we put out. Who knows? We've always got something going on. Come be social with World Gone Good. We're happy to be social back with you. Okay, here's today's question. Do you know what a comfortologist is? It's a term coined to describe an approach to medicine that prioritizes patient comfort and dignity. And who coined it, you ask? Well, our guest today did. Dr. Stephen Drabeck draws from his 4-decade career and personal journey as a cancer survivor and chronic pain patient to offer his own unique perspective. He's board certified in family medicine and hospice and palliative medicine as well. He has an advocacy for better end-of-life care with a passion for hospice and symptom management through assessment, empathetic communication, where he advocates for self-determination and personal choice to help his patients set realistic goals for their own care. That's a lot, right? That's just threw a lot at you, but I'm going to throw some more at you now. He's taken all of this, all his experience, written it down in his own groundbreaking memoir, The Comfortologist, a physician's empathetic perspective on compassion, caring, and pain relief, which has achieved him #1 best-selling status on Amazon. Now, when we start having these end-of-life conversations, it may seem like it's going to be dark and depressing or sad or simply something we should not be talking about. But I want to say a few things. So first off, this is not the first time we've discussed this, people. Let's go back, way back. I'm talking episode 11, Addison Gone Good, episode 12, Janice Gone Good, where we tackled both of these guests with these we didn't tackle them, you know what I'm saying? Tackled these topics with our guests. I threw the guests to the ground. No, you know what I'm saying? We tackled these topics with those good guests. And we went on to episode 25, Road Trip Gone Good, and episode 128, Signs Gone Good. All of these episodes talking about, this sounds crazy, death. And what's good about it. Definitely check those ones out after listening to this one. Now, second, as someone who was in the room with my family when my own father passed in 2016, I can tell you it was a truly beautiful and kind of magical thing to see and be part of. And I know, again, sounds insane. Maybe some people say, this is just wrong. We should not be talking about this. How could you feel that way? We should be sad and devastated and in mourning. Look, we were all those things. But the actual seconds leading up to it and watching my dad, who had been sick and in pain, open his eyes and smile just before he passed, it actually gave me peace and comfort. To this day, it remains one of the most astounding moments of my life. And our good guest knows more than a little something about what I am talking about. Here comes Dr. Stephen Drabeck to bring us his own good as a comfortologist. I have with me today a doctor who is going to be so pleased to hear that I just had my annual physical. For real.
Hallelujah.
Yes, I did. And I did the Cologuard test, which I've never done before.
Uh-huh.
Sounded like fun. And it's a little trippy.
It's much easier than a colonoscopy.
I went ahead and did that. That all came clean. I'm clean. I'm good to go. I have a fantastic doctor that I love.
That's very important.
Yes, isn't it?
Interpersonal interaction is the key to good medicine.
Now, let me start here. Did you always want to be a doctor?
Oddly enough, my sister tricked me into going to college. True story. Yeah, after high school, my brother and I, we were a year apart, but we graduated together and we didn't make any plans. You know how men are. And she said, will you and your brother help me move to college? Sure, we'll take a day off work. We get to Weatherford, Oklahoma, and she says, let's walk around. Let's look at the possibility of maybe going to school here. Sure, that sounds good. And the rest is history.
Wow. Did you ever have another passion you were looking into, or you were just sort of living life as it happened?
Living life as it happened. I actually put myself through college doing front end and brake work, working on cars. So that's a hobby still to this day.
Okay, so here comes the question. What's the correlation? Are there correlations between looking under the hood of into the chassis and the motor and all that good stuff and looking at a patient?
It's a diagnostic approach. If your car won't run and it's not making any sound and the lights don't come on, you don't have power. So it's a battery cable, faulty ground, but there's a lot of similarities. People look at me funny when I say that, but truly is a lot of similarities with the human body. It's a lot more complex, but you kind of take a similar path as far as diagnostic things.
Do you think as a nation, I mean, this is an overall broad question, right? Are we taking care of ourselves in the proper way, in the best way?
I think medicine has a lot of good intent, but there's so much of it that is personal agendas. My quality of life is much more important than my quantity. And there's no better person to describe what I prefer as a quality of life than myself.
Now, you at 30 years old
Mm-hmm.
had esophageal cancer.
Mm-hmm.
Can you take us through that time period? Can you tell us, start from the beginning, like how did you find out you had it and what was your first emotional response?
Well, it goes back to when I was a teenager and young adult. I just had horrible reflux much of my life. And then as I got into medical school, medical students have the opportunities to have financial gain by being laboratory rats. There's medical FDA clinical trials that you can sign up for, and if you qualify for it, you get paid to be that laboratory rat. And so I had bad reflux, so I thought, here's one for a drug called Zantac. And I went to see the clinical investigator and did some tests, and lo and behold, he thought I had reflux as well. I could have told him so, but you have to prove it. So I have an upper endoscopy where they go down into my stomach, take biopsies, and look around. And as he said to me, it's not normal, but it's not abnormal. The biopsies don't look like normal tissue, but we just don't have a good answer. But I did not qualify for the clinical trial. But my reimbursement was far greater than any monetary, because he sent me a letter that said, you may want to have this looked at 5 years from now. And 5 years later, I returned from a ski trip with college friends and had a little episode of vomiting and just a little bit of blood tinge. I had no other symptoms other than my usual reflux. So I called a gastroenterologist that I was working with. This is during my residency. And he's kind of a gruff old guy, and he just said, come on down. We'll go in there and look around. I've looked in so many gullets. And he did. And he described it as hamburger meat, the lower part of my esophagus. And the first biopsy came back dysplasia, which means angry tissue. And so we treated it. Now, Zantac had become available in that time frame. So I was put on some of the acid-blocking drugs, as well as the active ingredient in Pepto-Bismol, which is bismuth, which was effective. We cleared up the inflammation of my esophagus. And when he looked about a month later, there was one small area that wasn't healed up. And he did a biopsy of that. He did that on a Friday, which was to enable me to go from Tulsa, where I was in my residency, back to Oklahoma City, the Oklahoma City area, to look for a home, because I would be moving 6 months later. And so he said, when you get back to Tulsa Sunday night, he was on call. He said, come to the hospital, page me, and I'll meet you. And here I am, a medically training individual, I should say. And he takes me up to a room. We go in. He closes the door. And he says, sit down. And I said, well, is the dysplasia better? And all he could say was, no, it's worse. He did not say cancer. So in that inquisitive mode of my life, a couple of days later, I go down to the basement of the hospital and I look up the pathologist who would have looked at the biopsies. I introduced myself and I said, can we look at the slides to see how bad the dysplasia is? He said, well, no, I don't have enough time, but it's not dysplasia, it's adenocarcinoma. And I just kind of was dumbfounded. I remember walking out of the basement of the hospital directly to my car and saying, I don't want to have cancer of the esophagus because it's usually found, and a few months later, you're gone. And that is still the typical course for that disease. But because I did not qualify for Zantac clinical trials, I was pushed down that path. And at this point in my life, 38 years and 2 months later, but who's counting? I'm thankful for that. It molded my career. And that very pathologist, I'm sure, called JB, who was the doctor who couldn't tell me it was cancer. Probably the conversation went something like, oh, I think I screwed up. I told him it was cancer. But, JB was a friend as well. He just could not say it. And I understand that, but I never, ever neglected to say cancer when there was cancer for patients over the next 40 years. I think, it's important. But that very pathologist is who coordinated and ended up going to the Mayo Clinic, where I was operated by a surgeon who was a pioneer in esophageal cancer. I had the most up-to-date procedure at that time in 1987. And I remember so many things that surgeon said to me. He looked at me and he said, Dr. Drabeck, God has taken care of you for 30 years. Why would he stop now? That's a surgeon. There's not many surgeons that talk like that. They're just matter of fact and down to business. So, very thankful for all the events that happened. And they all fall under what I refer to as God winks. A God wink is when you go through something that you think, why would God do this to me? And when you get through it, you realize he had your back the entire time. And, it's about the most difficult concept in life, which is an F word. And that F word is faith. And it's molded my entire career.
Yeah, and it was a shift for you, I imagine. I know it for a fact because you wrote a book that is somewhat based in this, because it was a launching point for you to shift your perspective as a doctor yourself.
Absolutely. And God's got a weird sense of humor, but he's always looking out for us. And like I say, the most difficult concept in life, that F word, is faith. And I've said that to many, many patients over the years. And not very many of them say faith immediately, but I had a minister once that, he was right on top of it. Most of them look at me and with this, oh my God, what's Drebeck going to say now?
Do you remember the first patient or the first few days when you went back to practicing? Do you remember a shift then immediately in how you walked into the office, how you viewed the first patient that walked in your door?
I was in my last few months of residency training. So I had surgery on April 28th of 1987. We moved to Yukon, Oklahoma, right outside of Oklahoma City in the first week of July. And I was going to work for one of the big hospital systems. The clinic wasn't built yet. So I had about 3 months, July, August, and then into September before the clinic opened. So I went around. Yukon is kind of a smaller town outside of Oklahoma City, and I went around and met all the pharmacists. I met some of the bank presidents. I had a really good, as I refer to it, a dog and pony show. The marketing people took me around into the community and got me very well established. And I've always reflected on that and realized how important it is in small town America. But yeah, when I first started seeing patients, the impersonal aspects of it created a lot of conflict for me, because I think I've been Dr. Steve, as I told the nurses at the Mayo Clinic, I was a patient then, not a doctor. And only one nurse, and it was the nighttime nurse up on the floor in the post-op period, that she would not call me anything short of Dr. Drebeck. And turns out she was a military nurse, which you would expect, the yes sirs, but she was also the one there when I woke up from a bad dream in the middle of the night, dreaming that I was in a veterans hospital and disoriented. And when I called the nurse, she was there to comfort me and to reorient me. So there's so many poignant moments that occurred in that time frame. It's just God's weird sense of humor.
But you also sound like somebody who allows a path to come before you and travel that path, if I can put it that way. Because going back to the story about your sister could have been a messenger through something bigger than us, or your sister just had bigger dreams for you, or your sister saw potential in you. It's all perspective and what we all are comfortable in looking at it, right?
Absolutely.
You were open to it. I think that is the most powerful thing we can be as human beings, is to be open to change, open to different ideas.
Open-minded.
Open-minded. Yeah.
Yeah. Even though it's something bad, when I tell patients that it's a cancer, I'm still the guy that's digging through the horse manure looking for the pony. We don't have all the answers. There are people that had stage 4 widely spread cancer that lived 15 years when they should not have. And then there's the people that they're diagnosed with a cancer or a bad disease and they die within a very short time. And attitude really has a lot to do with it. Of all the things that shaped my career, cancer was the first, but then I had a life-threatening intestinal bleed about 8 years later that I never worried about dying. But the gastroenterologist that was caring for me in the Oklahoma City hospital, he was quite distraught over it. But if it wasn't for his diligence, I may not have overcome that either. So I've just had many empathetic experiences, and I've learned from every one of them. Currently, I have chronic lymphocytic leukemia, and people hear that and think, "Oh my gosh!" But until I tell them, they don't know it. And I'm relatively normal physically. Emotionally, not so much, but
join the club.
It's that sense of humor that I use even in the passion of my profession is end of life care. And that intestinal bleed that led to having chronic pain 27, 28 years ago, I've had it since then. So dealing with it and realizing that people in the world that have chronic pain deserve to be treated with medications that improve their quality of life. We can't take it away, but we can manage it. So it's been an interesting career. I love what I do, and I really wish I wouldn't have had to, retire from the office practice, but lack of support, lack of focus on quality of life in medicine was frustrating to me.
Well, this all led to you writing a book called, wait for it, everybody, The Comfortologist, a physician's empathetic perspective on compassion, caring, and pain relief, which we were just talking about. When did you sit down and say, I'm going to write a book? Who told you, go write a book? Did you have a message come to you within yourself that says, you know what? I think I'm going to do this.
Well, I thought about it over the years many, many times, and my ex-wife, I always have to laugh because we're best friends, and we get such a tremendous enjoyment of introducing one another as exes. People just look at you funny, but she and I we talked about it many times, and just decided to do it last year, and it was actually more fun than I ever dreamed. It's also brought back many, many stories about patients that I've cared for. I did 3 years overseeing an inpatient hospice unit in Oklahoma City, and I've done hospice for 33 years, and I absolutely love it. Those people have one need, and that is somebody to listen and to think in terms of quality of life. And the rules that I came up with, rule number 1, everyone on this earth will die. Rule number 2, God decides. Rule number 3 is see rule number 2. I always got calls. I got calls from colleagues out of state. I got requests at the hospital. If somebody had esophageal cancer, they would, either the provider or family member would say, will you go by and talk to them? And I always have. And I remember one doctor's wife. She had had the same surgery that I had, and she was in the ICU. She was on a ventilator. She aspirated and was just having a really tough time. And I walked into her ICU room and said, Miss So-and-so, you and I have something in common. Her eyes popped open, and I said, I had the same surgery that you did a number of years back. And 2 days later, she was off the ventilator. She was motivated. And so those things really make me focus on what I can do to help them. For her, it was to show her that you can get over this. Of course, I was 30. I was running 3 miles every day before I had the surgery. And so it's just an age difference was a big factor, but it's hard to get motivated from a position that is so low. I mean, that's rock bottom. And that was the first surgery I ever had, was taking out my esophagus. But, it's all good. And I'm the luckiest son of a gun around. And I like to share those stories. Most of my book is about hospice patients, about helping them do what they wanted to do. I had one guy who wanted to go and take his grandchildren fishing. And we enabled him getting out of the hospital, get off of the conveyor belt of procedure after procedure. And after he passed away, his sister sent me a picture of him that I still carry on my phone today, standing on a pier with his grandchildren. And I had another patient who wanted to go home to die. He had lung cancer, and his pulmonologist, who's a very excellent pulmonologist, and I told him one day, I said, Bill, you take too good a care of some of these people. But if you've got widespread cancer, to say to somebody, you can't go home till your oxygen saturation improves, wait a minute, we're dealing with something that's not going to improve. And so the pulmonologist said, well, we'll let him go to the hospice house, which was our inpatient unit, and Drebeck will take care of him. And, he told me the same as everything else. I want to go home. I know I'm going to die. I want to go home. I want to be with my family and my dogs. And I'm a dog person. So we moved him to the hospice house one afternoon. Guess where he went the following morning? He went home. He's from rural Oklahoma, about 2 hours west of Oklahoma City, and he went home where he wanted to be. I always told people that the Wizard of Oz is something we all kind of grew up. We, us old, distinguished people. But Dorothy was correct. There is no place like home. Dying in a hospital is a lonely, lonely place. I went out of my way to try to help people not be alone at their final breath. But over the years, I've learned, especially in males, sometimes they wait for everybody to leave. It's a macho thing with men, especially if their little girl, their daughter, who is an adult, they will wait till everyone leaves the room and take their final breath. I saw it happen so many times. and they also wait for certain people. I was on a vacation when I had a 22-year-old patient who was dying, and I was getting ready to leave for vacation for a week, and I told the mother, or no, I told the aunt who was with her, the patient was non-responsive. She had no IV per their choice. She had no intake whatsoever. And I told the family, I don't think she'll be here when I return. Guess what? I returned a week later, and the first thing I looked at when I walked into the hospice house, and she was still there. And ended up being the last patient that I saw. But when I walked in through the room, she took her final breath and passed. And I looked at the mother who was at the bedside. I said, this is not supposed to happen to me. But that little girl was someone that we helped get home with better pain control to do whatever she needed to do. And she returned 2 months later is when she passed. So I'm convinced she was waiting for me to get back.
Where do people find the book? How do they purchase the book? Plug away, my friend.
Amazon.com.
And brag away, because you're a #1 bestseller on there. And guess what? So am I.
Cool.
My first book, a cozy mystery I wrote, hit #1 on the mystery chart. I couldn't believe it either, and it hit #1. I was like, "What is happening?"
Yeah, you're putting something out there that people are interested in.
As are you.
Absolutely, and it also helps people that don't quite understand me have a better understanding, because it starts off with the death of my mother when I was 6 years old, 10 days before my 7th birthday, which it was in October of 1963, November of 1963, John F. Kennedy was assassinated. I don't know about you, but I really don't want to hear any new theories. And I never understood why I would get so angry. A new theory. Who shot JFK? Why? When? And I would just get so frustrated. But I learned from it, and it took me about probably 10 years ago. I go, I'm having an anniversary reaction, because that was at the same time my mother passed away. And oddly enough, she died from an anesthetic error. And the anesthesiologist took his own life because they were friends. So after her death, he took his own life because he never got over it. And I had the story of that night told to me by another anesthesiologist that I met for the first time. He filled in a lot of details. And then I looked at him and I said, that was my mother. I'll never forget the look on his face. But it's a memoir of my life, and my life, too much of my life has been medicine. Only regrets I have are some of the times that I spent away from home. And as my son, when he was young, would say, Dad, do you have another stupid medium? Referring to meetings that I was going to. But I love what I do, and I still am active in hospice at this time. I'm trying to educate the medical community about chronic pain, but we're all brainwashed in medical education. And, pain medications work. I've taken medication for pain on a regular basis for 26, 27 years. I'm a better person when my pain is better controlled. And I'm a better person when I'm retired, too. But I'm going to go the full length to help people in their final months, weeks, days, hours, minutes, seconds of their life. And God just keeps showing me his weird sense of humor. And he cracks me up.
We close this show with a very simple question. It's not even a question. It is a statement to finish. You can finish it any way you want. Finish this statement. Tell me something good.
Something good. There are valuable and worthwhile good deaths that occur. I have to watch my response to death, because to me, death means the pain and suffering is gone. So that's the good thing for me. A good death, which I'm going to be speaking to this fall at a local gathering. But there are good deaths that occur, and they don't all have to be bad deaths, but it's much better when it's good. It's much better when the family accepts it and embraces it.
Thank you, Dr. Drabeck, for sharing your good with us. Next time on World Gone Good.
Don't get left behind. Don't have this grudge against your life and against your job and against your time. Flip the script and make it positive. Find a way to just bring some peace into your life and live longer and live more in the now. Be more aware, be more present. Because I promise you, this one life that you have, even if you feel like you're coming back as something or something else, this one life that you're living right now, why not make it the best it can be?
Kever Brene is a voiceover artist, a singer, an author, and perhaps most importantly, she's a happy person right where she is right now. We are talking with her about everything from the house parties her parents threw when she was a kid, to her going from singing in church all the way to singing backup for Michael Jackson, to mentoring with a mic herself. That's what she does. And she brings up the next generation of artists and creatives. She said it in the clip we just played. Don't get left behind. And I love it. And so much more she has to say, which you will hear all of on our next all-new episode, which just so happens to be brimming with hope and positivity. Until then, be good.